Hi everyone, my name is Dr. Nandini Dadu from Dadu Medical Center, and today I'm really obliged to have Dr. Noda with us. So, hi Dr. Nodu.
Hello, namaste everyone. First,
Yeah.
I'll introduce myself.
please.
My name is Dr. Noda. I'm from Georgia. I'm plastic surgery, and at the same time, I'm work with Aptos company more than 5 years. And today, I will try to share my experience about this product. We have 30 years history, and we have like several generations of thread, like first generation, second generation, third generation, and fourth generation threads, like Namika. Namika is our last generation. In this case, we have inside HA, this is coloring acid, and after 3 weeks, patients feel that not only skin lifting, skin quality is much more better.
Yeah. So when you were talking about threads, so when I talk about from an Indian perspective, I have a lot of patients who actually are not considering threads for their facelift. They usually they probably would recognize that they have sagging jowls, they have nasolabial folds, maybe the eyebrows are also bothering them, the nose structure whatsoever. But still, they are not there that there is a modality that can actually help them get a result. How gratifying, how long should be the expectation of the result, and what is the duration when I get the result, and there is a lot of questions. So now when I talk about this, I want to exactly know from you. I hope we both, India or outside India, we are practicing same hierarchy when we talk about sagging, that how do we escalate, like somebody who just wants to go for an RF or a HIFU technology and is not understanding, then probably that is not going to be that one modality that will help their concern. And then maybe suggesting them a filler, Botox. They again are skeptical because they don't want to go for an injectable, or they think I'm too young for this to start. Third comes the thread in our range where threads become too invasive for them and they get scared. And fourth, which is very funny, that they can actually consider a surgical facelift but still not think of threads. So I want your perspective on that how you actually place threads when in this, and what is going to be your patient selection criteria.
Perfect. What's the benefits of our product? After thread lifting level method, in case of Aptos, we have a result not only 6 months, 8 months, we have a long-lasting result like 1.5, 2 years. And cause of composition, we don't have fibrotic tissues inside after the procedure. And I did like many procedures in India, and I saw that many problems we have in case of jawline, because we always have a round face, heavy parts, big compartments on jawline. In this case, we have good options. We have double threads, and in case of double threads, we have very good result in case of lower face. We have some other products for upper face, for example. And what's important, after our procedure, we have always natural result. In case of fillers, for example, you know that after the procedure, we have a little bit big face, but in case of threads, we always have natural result. Rehabilitation period is only like 2-3 days enough, and after 3 days we don't have swelling, we don't have redness, we don't have any kind of asymmetry, and it's most important, I think, for Indian patients.
Right. So when I would say, is there any kind of a test that you would do to assess, okay, this kind of a skin is good for thread, might respond to, like there's a pinch test or something, like, we do the vector projection to see if we are able to get that kind of projection after thread. So is there anything particular that you look for?
Okay, what means Aptos solution? Aptos always gives solution to our patients, because today we have more than 30 products and 50 methods, because every patient is different. Everyone have a different problems. That's why, in case if we will try to find right patient, we will choose the right product, and the result will be always amazing. Sometimes we are doing some thread combination, some products, and it's important that after this combination, our patient always have natural result, and the result is like it was like 5 years, 10 years ago.
All right. And do you also combine two modalities together? Like if you have a patient with a lot of nasolabial and a lot of sagging, maybe lost a lot of weight, then would you do threads and fillers together to give a defined result? And also, would you do that on the same day?
Sometimes when I'm touching with my finger patients, I'm lifting tissues, I feel that we still have this nasolabial fold, because sometimes it's very deep. In this case, we have also nano threads, and we're trying to fill this nasolabial fold with these nano threads. After 2-3 weeks, it gives us fibrotic tissues inside, and with this one, we can fill our nasolabial fold. In case of upper face, we have strong mimic activity. And sometimes it will be good option in case if first time we will try like Botox and after 3 weeks we will try thread. This is like best combination in case of upper face.
And if I ask you, like, tell me 5 concerns or 5 areas where you think Aptos can give actually very gratifying results with no other modality giving that. So
today with our threads, we can do like upper face. It always gives us good option in case if we have a young patient, we have a little bit small thread. But in case if you see that patient have too much skin or upper eyelid, with our advanced technique, we can lift not only eyebrows, these extra tissues also. In case of mid face, when you see that patient have 2nd degree or 3rd degree of ptosis, we have like advanced technique. We are using double needles for jawline. In case of lower face, also we have 2 options. Sometimes patient have only skin ptosis. Sometimes you see that patient have fatty tissues inside. Yeah. With our advanced technique, we always have a good result in case of lower face. Also, we are using thread for nose. When I want to lift tip of nose, we have thread for otoplasty, for body areas also, and we are using our thread in intimate gynecology also.
Okay, so now this brings me to a point that if somebody comes to me with a concern of double chin, and so would you first like to consider maybe a lipolytic product and then go for threads, or you would do together?
Yeah,
Because I think once anybody lands up, they are too restless to get a result very quickly. And then they're like, okay, whatever needed, just do it in one sitting probably. But then is there a step up that you first lipolize or maybe do a little bit of, fat reduction here, and then we do threads that will give more better results, or we can do together? And still I know that since thread is going to take 2 months of time to, give results. So that would be a period for the patient.
In case of lower face, before I will start my procedure, first I will see this part, I will touch with my finger. If I feel that patient have heavy tissues, first, yeah, sure, it will be good if I will start with liposuction, or I will do lipolytics like few times, and after 3 weeks, I will try my threads to have like best result.
Right. And also, since I have a lot of patients now who are coming to me with, weight loss, and they have loose skin, so how great results do we get when we talk about threads for inner arm sagging, abdomen laxity, inner thighs? And yes, so these are my concern areas for my patients now when we are on a weight loss journey and they suddenly feel that they have lost like 20 kgs and they've been doing toning and everything, but this after reduction of 20 kgs, they are still not able to cope up with that kind of toning. So they would want that kind of, firm body. So how will threads help me there?
In case of body, we are always using crossing technique. We're not cutting the tissues, just small entry points. Our thread will be always in subcutaneous layer. After the procedure, patients have swelling only 2 days, 3 days, and after 3 days, there is no any redness, swelling, and some other problems. I think it's a good solution in case if patient have some ptosis, also in case of different part of bodies.
Right. And do you also, I think that I also get a lot of queries for breast lift. So how would you place Aptos threads for breast lift? Like, do we think that we can get results, or there's any specific criteria again when we talk about breast lift?
In case of breast, the best patient will be in case if patients don't have heavy tissues. In case of heavy tissues, result will be like 4 months, 5 months. But if we will try to find right patient, in this case, result will be not 4 months, 5 months. It will long like 1.5, 2 years.
Right.
Because in this area, we don't have some mimic activity, and that's why the result will be long lasting always.
Right. So today I have few cases for you. Probably I'll brief you because again, like I said, I have 2 patients who have recently lost weight, and now the nasolabial fold is concerning them a lot. So since I've got to know about this new spring nano technique of threads about nasolabial fold, I want to focus my today's this thing on that. And I would love to give my viewers also a choice that nasolabial fold is something that is is treatable. We are trying to do with fillers, we are trying to do with Aptos, the double needle also and everything. But I still think that if it can be even more minimally invasive, I would love to tell my patients about that. So one, I have nasolabial fold for you. Then I have a patient again who has lost a lot of weight and has inner arm laxity and has abdominal laxity. So I want to cover all these cases. If I have a eyebrow left for you, because that's one concern that comes up with middle-aged females, that suddenly they want to do Botox, but they are not realizing that probably Botox cannot do that kind of lift that they are looking for. And blepharoplasty is something they do not want to opt for. So I want to give them that there's a midway, and nose correction and submental, again, like I told you, weight loss, but then submental laxity. So if we can consider all these today, I'll be really happy to have your great insights about these and training from you. So, and of course, in midweek, between the trainings also, I would be asking you questions about if there's a concern, and if you think that the patient needs something more, probably, or we can do it in a different approach so that we can give more gratifying results. So I would like to have your opinion on that as well.
Well,
thank you so much.
It will be my pleasure working with you today. I'll try to share my experience.
Thank you so much. Thank you, everyone. Thanks, Dr. Noda, for being with us.